it was at this parent evening, and I hadn't kind of logicked out that my friend was going to be there, which was silly because like I know that both our girls go to the same school, and I was really overwhelmed, and I can hear her going, Dermot, and I turn around and I'm just like, I don't know what to say or anything. And then afterwards I was like, I'm really sorry if I like completely blanked you and like didn't respond very well.
I think I do that a lot, and sometimes I don't realise I've blanked people because my brain has just gone, no.
Yeah.
It's not happening. No.
Yeah. You catch up with it like later on, and you're like, oh, that's what I should have said back.
And like I realise people think I'm being really rude, and it's actually just I don't go, oh look, there's that person, I'm going to ignore them. Yeah. It's just I can't deal with that person being in the wrong.
I've got a little hack for that. Everybody knows that I can't see without my glasses. So if I'm wearing contacts or I take my glasses off and I'm genuinely quite blind, then I can't see faces and I can't recognise individuals, so I don't have to talk to anybody.
That's a very good point.
Yeah. So I say, oh, did I have my glasses on when you said hello? Oh no, I don't think you did. That's why you didn't say hello. See? Hack.
I think that the context blindness for me is sometimes related to masking though, for sure. And I guess we'll talk about that a bit in a minute.
Should we explain what masking is?
Yeah, so our next myth is going to be about not as many women being autistic, or that women can't be autistic, and a little bit about...
In case you haven't noticed, we're all women.
Yeah, we're all women. So it's going to be about women and camouflaging and masking in general, I guess, because not all women mask and some men do. So it's always kind of a disclaimer. If you've met one person with autism, you've met one person with autism, isn't it?
Yes.
Okay. So the thing about context blindness comes into masking because I kind of have like hats for each set of friends or work colleagues or things like that. And then I don't know which self to perform.
So I have a story about this, and I am genuinely, because I spend so much time, most of my time is spent in mental health services seeing a professional or whatever. And I bump into them because it's Pembrokeshire where I live. It's a small place, we're going to bump into each other. And like some of them have genuinely considered that I have dissociative identity disorder, because my masking means that in different contexts I have a different kind of outside to me because of masking. And like they've genuinely thought she's in different personalities here, like she has different personalities, and it's kind of true, but it's not dissociative identity, it's just masking.
But that happens with borderline personality disorder and all the different personality disorders, really, doesn't it, as well, that lots of women get diagnosed with those kind of in error, really, because it looks the same on the surface, same as eating disorders. It often looks the same on the surface because lots of autistic women present as having eating disorders, but often the underlying function of that behaviour is different. The driver's different. So it's not always about body image. Sometimes it's about routine or control or categorising and numbers and things like that. Sensory issues.
And lots of people have hyper focus on food. Which then is kind of thought to be anorexia.
And for some women and girls as well, it's to stave off puberty because they don't feel like they align with that gender, and they don't want that transition to happen.
Either gender, or it's because actually puberty changes happen really quickly, and autistic people don't like change. Like for me, my eating disorder started because I didn't like the way my body was changing. It wasn't necessarily I thought I was fat. It was because like, oh my god, why is this happening? It's too quick.
So it's not always perhaps that they're like, well, I don't identify as female, but perhaps they're just not ready for the changes as well, and how that happens. And often, you know, we've got something called a multiple spectrum of ages, haven't we? So chronologically, developmentally, emotionally, socially, and our body might be changing at a rate that those other kind of profiles aren't keeping up with. So we try and stave that off. And some people use it as a social thing. Women.
Where were we?
Women.
Women.
So it does kind of fit in. We went a little bit around the houses, but
masking.
Bringing back women and eating disorders and stuff. I struggled with eating disorders, and I still kind of do to this day, because during my 2 pregnancies I had gestational diabetes, which means it stops once I deliver. But for me, I couldn't control my emotions around food because I was told you have to keep your blood sugar under these certain numbers. If you don't, bad things will happen to your baby, which is the worst thing you can say to anybody. So that kind of emotional pressure on keeping those numbers so, quite down and as perfect as I could be. That was me almost auditioning my own pregnancy. Yeah. When I took my book up to the consultant, it was because I was struggling with the social side of interacting and I couldn't express my concerns. The only way I could really express how I was managing was black and white numbers on my diary. And when I gave that, I was kind of asking for acceptance in return.
And validation that you are a good mother, or you're going to be a good mother.
And it's something I still struggle with now. I still got quite a big fear of sugar, even though I'm not diabetic anymore.
Yeah.
But
it's kind of built. And I think if you've got autism as well, we get stuck to routines. And it's not that we can just choose to stop those routines. So if someone, say, starts developing routines by which they restrict the amount of food they eat, trying to stop doing that becomes almost impossible. So when I was getting better in my eating disorder, for me it wasn't about being able to eat normally. It was about trying to push that routine into limits that were still healthy. So I wasn't restricting, but still keeping that routine. Yeah. And a lot of people would say, well, that's not recovery. And actually, for me, that's as far as I can get as an autistic person. Yeah. Because I can't take that routine away.
Yeah, absolutely. And often sort of the therapies and the things that are suggested for autistic people, they don't work as well. So, I read about one autistic therapist who's kind of anonymous. She's on Twitter. She hasn't kind of outed herself professionally, I don't think. But she says, she had a client come to her from somebody else who was also autistic. And they had sort of said, well, stop practicing the day and stop replaying it because that's anxiety and you need to stop that. But actually for her it was a coping mechanism. So she was trying to tell her to take that coping mechanism away. So you can't treat it the same way as you would social anxiety.
So the traditional way of treating eating disorders is to get someone's weight up to a healthy level and then to tackle someone's fear of being fat. I don't fear being fat. I didn't believe I was fat. I only started actually getting treatment for anorexia was because I was in a ward with other anorexic women who were saying these things, and I actually used my masking. And then I started saying the same things, and they were like, "Oh, she's got anorexia now." And I'd had the same issues all the way through, but now I was saying that I was fat phobic when I actually wasn't because of the masking thing. But then the treatment was, well, we have to tackle this fat phobia, and I was going, well, it doesn't really bother me at all. Like, I don't really care.
Yeah. And I had a really restricted diet as a child and was very underweight at one point, anemic and all of that. And everyone was sort of saying, oh, you're anorexic. And the GP was saying, I think you've got an eating disorder. And I was saying, no, I'm actually really happy with my body. So in a lot of ways, I think perhaps being autistic made me much more logical. And well, actually, I really like how I look. It wasn't really a concern for me, but they were like, no, you are, you just don't realise you are.
Yeah,
you subconsciously hate yourself.
I was saying, I'm fine, I'm not scared of being fat, I don't think I'm fat, and they'll go, denial.
Yeah, that's what it was like, and I was going, no, I don't like food, and they were going, yeah, but that's because...
But the thing with eating disorder treatment as well, if autistic women are accessing treatment and actually if the treatment is about fat phobia, that's not suitable.
No, absolutely not.
What tends to happen then is professionals go, well, they're not engaging.
Yeah,
discharge the woman and say, well, it's their fault because they're not engaging.
Yeah.
When actually the whole therapy from the start was wrong.
Yeah. Yeah, and you get that with cognitive behavioural therapy as well. So you'll sort of say, well, go online and work out what you could have said differently and what they could have done differently, and you just like, that doesn't work. And mindfulness. So I really like mindfulness as it goes, but for one thing, it doesn't sort of happen instantly. You have to practice it for a long time. I always say there's a reason why sort of Buddhist monks spend decades perfecting it. And if you tell an autistic person or somebody with ADHD as well, particularly to empty their mind, that's not going to happen. And if you say to me, oh, imagine you're in a green meadow, I'm like, ooh, bugs, do.
Yeah.
Ooh,
the sound of bees.
It's warm, I can feel the wind, you know, and it's about finding the right one, but then you get, oh, it's not working. Or...
I think where we're veering into is looking at how autistic people often experience health inequalities because therapies and treatments and the whole healthcare system and social care is set up for neurotypical people, and professionals aren't able to be flexible in how they work. So they will often try and apply therapies even if they're not appropriate to autistic people.